You hear the expression, education is power, and certainly it's true when it comes to your hearing health. Louisville Family Audiology. I have Dr. Abigail Sweeney with me once again. Dr. Sweeney, welcome back.
Yes, thank you. It's so nice to come here once a month and chat with you about the thing that I love most, which is the ears and the hearing. So
I love when you come on because you educate me, and there's so much I didn't know about, especially about the relationship between hearing and brain function. Before we get into that, for folks who are not familiar with your business, tell them a little bit about the services and things that you offer.
So we are a full-service audiology practice, you know, kind of running the gamut of your hearing healthcare journey. We see adults for hearing instruments and teen-age kids for hearing instruments and hearing help. And then we also, you know, we do hearing tests, full diagnostic hearing evaluations. We do implantable devices like cochlear implants and things of that nature. We also offer, you know, other services to help people who are having difficulty hearing. Tinnitus is a big one, of course, ringing in the ears. So we have a tinnitus specialist as well. So yeah, we offer a lot.
Yeah, we were talking about when we began the segment about the cognitive connection.
Yes.
So that's why we're going to focus today on a thing called, and I know nothing about this, so you're going to help me out here.
It's my favorite subject.
Well, good. I like that. Cognivue.
Yes.
Cognivue. Okay,
yes.
So I'm thinking cognitive. Okay,
yes.
What's it do?
Yes. Cognivue is an FDA-cleared cognitive screener that we, as audiologists at Louisville Family Audiology, feel that it is so important to get your cognitive abilities screened. One of the things a lot of people don't know about, like cognitive decline and things of that nature, there are preventable risk factors for cognitive decline, and the main one being hearing loss. I have my little brain hearing that says brain with untreated hearing loss. It's a little tired brain, and then brain with treated hearing loss. It's a happy brain, because it really does make your brain happy to be able to hear. So the #1 modifiable risk factor for cognitive decline in midlife is untreated hearing loss. #1. So as an audiologist, why wouldn't I give a patient a cognitive screener to see how they are, you know, functioning? And I actually have the Cognivue is an FDA-cleared cognitive screener. It is computer-based, but the nice thing about that computer-based piece is it doesn't require you have to know how to use a computer. You know, a lot of my older adults are like, oh, I'm not really tech savvy, and that's not a big deal at all. So the other cool thing about it is it uses adaptive psychophysics, which is a really long medical term just to mean that it's adapting to your specific physical abilities. So there's no bias. Because people are like, well, what if somebody has a slower reaction time because, you know, they're older, they don't have as like fast of reflexes? It adapts to that so that whatever your abilities are, it doesn't impact your cognitive scores at the end. And we actually have a little video to help kind of explain Cognivue.
All right, let's take a look at that video. Cognivue is the name. Here we go.
This is a screening to measure your cognitive performance. Cognitive performance is how your brain performs. Like your cardiovascular health or other important functions of your body, brain health should be a part of your routine health checkup. You may think brain health decline is only connected to dementia or Alzheimer's disease, but that's not true. It can be related to a number of risk factors like diabetes, hearing or vision issues, medication side effects, or even lack of sleep. Your brain health. This is the Cognivue, and it is your only interaction with the screening. To get comfortable with the Cognivue, go ahead and try it right now. Rotate it left, and then right. It's not an IQ test or a series of questions and answers. It's a series of different exercises.
And available at Louisville Family Audiology. Okay, just from talking to you, you've made me a little bit educated here. So you talk about tired brain, and from it's my understanding that's because it has to try so hard to hear that it's not able to function at full capacity, right?
That's exactly right. So what happens is when you are not able to hear well, hear clearly, your brain is focused so hard, it's like blinders. I tell people, imagine you're looking at a Wheel of Fortune board and you only have a couple letters. It's going to be really hard for your brain to try and figure out that puzzle, right? But if you have Wheel of Fortune, you're only missing a couple of vowels, you're going to read it automatically. And that's what the hearing instruments are giving as those letters back to the puzzle so that you can hear better and you're not working so hard. And when you work so hard, you're stealing oftentimes from the memory center of the brain. It reroutes and reorganizes to help the hearing portion, so then that memory portion can't do its primary function, which is to remember. And then really amazing, like super exciting thing about Cognivue is we've been giving it to people pre-test, 3 months post-test, and we are time and time again seeing improvements in their cognitive function on the Cognivue.
See, that was my next question here, because I think the goal is for those who have had hearing loss and perhaps all of these things you're talking about, they're experiencing that now. Can it improve? And you're saying it can.
It can, and I've seen it firsthand with some really incredible patients, and it is super exciting. It is so exciting because I'm able to give people tangible evidence that they are helping their hearing but also their brain health, and showing them that why it's such a vital investment in your quality of life.
So is this screening cost? Is it expensive, doctor?
I feel like it is so important to my ability to treat you more holistically that we don't charge for it. I want to have those answers so that I can give you my best, most educated recommendation for how to treat your hearing, because depending upon how you score on that screener as well, helps me better recommend technology for you, because I will know more specifically what your brain needs based upon the results on that screener.
See, this is interesting to me, because I think a lot of times that mom or dad starts having hearing issues, or they've had hearing issues, and then we associate that with aging process, and we're saying that's why they're also going downhill cognitively, because they're getting older. But you're saying, no, those two are related, and that's why.
In some cases, absolutely. Because what happens is when people have untreated hearing loss, they start to withdraw. When people start to withdraw and retreat and they don't participate in conversation, then you think they're slowing down. Their memory, they might not remember things. Well, it might not be that they didn't remember. Maybe they just didn't hear it to store it into their memory.
So you're going to refresh my brain is what you're going to do.
I am, yes.
I love that. I love that. Okay.
Yes.
So for someone who'd like an appointment, you already mentioned that Cognivue is free. The screening is free.
Yeah.
So how do they set up an appointment with you? What do you recommend?
So what we recommend is either phoning in at 502-215-8139. You can actually use that for our voice, like to talk to a real human, or you can text us. And we have monitoring on the text line all day long during business hours. And you can also go to our website, LouisvilleFamilyAudiology.com, and there's a little schedule tab, and it'll take you there to schedule an appointment directly. You
know what I think is amazing, doctor, is, okay, it makes perfect sense that dementia, Alzheimer's, that would be connected to hearing. But I thought it was, when I watched the video on Cognivue, you talked about other, diabetes and things. Isn't it amazing? To me, it's almost, it's really unbelievable how the body connects itself and connect the dots and all that.
Yes.
I mean, for you as a doctor, that's exciting, isn't it?
Yeah, no, it really is. And there are a lot of comorbidities that become really common with those patients that come in that you are kind of seeing cognitive decline or concerns about cognition at all. So, so it's exciting for me as an audiologist and a provider to show them, yes, you might be struggling in this area, but I can help you.
All right, Louisville Family Audiology, once again, if you want to make an appointment for yourself, for mom or dad or a loved one, this Cognivue, I think it's very, very exciting, cutting edge technology. Is there anything that you see on the horizon? I've got about a minute left with you, and I want to ask you, that you see on the horizon that really excites you when it comes to hearing health?
This.
Yeah, this, because I was going to say,
this is
you seem to be on the cutting edge here. So this is it. It's exciting for you because now you can actually say, you think you might be having some cognitive issues due to your hearing. I can find out through this Cognivue.
Yeah, it is just such a powerful tool that I'm able to empower people with different types of information. And I so love that. I mean, I really genuinely think, I've told people before, this is exactly what I wanted in my practice, but I didn't know what it was until I saw it. And I was like, yes, this is like, we have to be doing this. And so, yeah.
And available at Louisville Family Audiology. She is Dr. Abigail Sweeney. You're a great resource. Thank you once again. T-shirt is cool. You're going to make my brain all rested and ready to go. I love
exactly.
All right, Louisville Family Audiology. Call them today. Yes, the screening is absolutely free.